Welcome to the V3 implementation call. Today is October the 8th, 2025. If you haven't already, please update your name and affiliation in the participant list. Just a quick reminder, these meetings are recorded and shared on the NEMSIS website and the YouTube channel, so feel free to share with your team or review as needed. We encourage your participation, so please use the Q&A feature to ask any questions or make comments. We review them during the meeting as well as our post-meeting debrief. And as always, I get to go first. Share the agenda. So let's start with the stakeholder introductions. So we do these to get to know the others who are on the call and build connections that could lead to further collaboration, maybe get some ideas for new hobbies every once in a while, and to spotlight somebody for 30 to 45 seconds, and it's just because it's a lot of fun. We asked this person, what do they like to do to relax or unwind? And they like to relax at Canyon Lake. And this is our AI-generated graphic for relaxing at Canyon Lake. I hope you like it. Some interesting facts. They once worked as a paper boy. Others may not know they possess multiple cybersecurity certifications. You get along well with my brother. We asked how long they've been in EMS or healthcare and or data. 25 years. And we always ask, what do you like best about your job? And their answer was merging technology with technical solutions. Any guesses? Welcome, Mr. Bob Yanusadis, Commissioner for the Criminal Services District number 2. If you have not been introduced, here is a nifty little QR code you can scan with your phone right now. It'll open the form so you too can be introduced. As always, I will put the link in the chat if you're joining from a computer, make things a little bit easier. Thank you. That's the update or the stakeholder introduction. I have the next thing on the agenda as well, which is a review of a desktop or a dashboard from our website. And today, I'm going to review the performance measures by agency. So, as always, start from our home page. Go to View Reports and then State Reports if you're state level. NEMSIS Dashboards. Go to the 6th one down, State Performance Measure Dashboard. You'll go through your Okta. And then you'll see this for your state. From there, I'm just picking a state so that I have data to show you here. And I use North Carolina because James is kind enough to not get mad at me for doing that. Then you can pick, oops. Sorry about that. As I was saying, you can pick your agency. I am having difficulties with this. I'm not going to touch it. You can pick your agency that you want to see, and it'll compare it against your state and the national. And you can also download directly from this page if you'd like. If you've picked an agency, it'll show you the agency bar if you've picked specific ones, and it's comparing all to the national segments there. And you can download the data or cross tab, and you can pick what you'd like to have. But a feature that many of you may not know about is at the top now, there's a new tab. I'm showing you here that this is how you pick the 11 different aspects from the NEMSIS measures. Pick a measure, and it'll show you that specific one. And at the top, there's a new tab where you pick your state, and you can do performance measures by agency. So your state will already be there. I'm picking North Carolina again, just so that I have data. You can pick one or specific agencies, and then your specific measure, and then go to the bottom, and you can easily download a crosstab to get this data so that you can then present it yourself. And that'll download an Excel file. And that's a quick review of the performance measure dashboards. I show this because several people have asked me about it in the past month or so. So if two or more people have asked me about it, I feel like there's a reason that they're asking and that others may be interested as well. So that's it for me. The next person up is Mr. Chris Hoffman with an update on the location of critical patch CP6 and CP2 information on the website.
Perfect. Thank you, John. So if, John, can you confirm that you can see the website on the screen?
I do. I see your website.
Perfect. Thank you so much. So what I'm going to quickly show you here is that the location of the critical patches for CP6 and CP2 on the website. If you come to NEMSIS.org on the main page, navigate to in the top right-hand side over to Technical Resources, hover over Technical Resources, and then go over to Data Dictionaries and XSD and click there. You'll be brought to the Data Dictionaries and XSD webpage. First on the list here, you will see that the new NEMSIS version here at the top for CP2 is live. If you click on any of the resources here, they are the new versions of the Data Dictionary for Critical Patch 2. And then if you scroll down past those resources, then you can get to version 3.0 CP6. Same here. If you click on any of these resources, these have been updated to the latest versions. If you're looking for these, or if you are looking to share these with someone, that is the current location. If there are any questions or issues with this page, feel free to scroll down to the bottom of the NEMSIS website where you have the Submit a Help Desk Ticket button. Click on that, and then you'll be taken to our help desk portal. And from here, you can put in a help desk ticket and have your question sent to the person who can help you the best, and they will get right back in touch with you. Let's see. I have a question in the chat, and in the Q&A, and if someone, I've moved it into the section so everyone can see it. If someone who's more knowledgeable about this could answer that question for me, I'd sure appreciate it.
Yeah, thanks, Chris. I'm going to cover a little bit of that, I think, with the next topic, and so be happy to speak to Lauren's question.
Awesome. Lauren, thank you very much for the great segue. Clay, go ahead and take it from here.
Yeah, Lauren, thank you for that. Yeah, so let's talk a little bit about where we are with the critical patches, and we have a survey that we'd like the states and actually the receive and process vendors to be prepared to take. We'll literally pause for about 3 minutes. It's a very short survey. I'm just asking for states that haven't completed it to complete it to make sure that we can provide kind of information to vendors and to all states in regards to what their plans are in regards to implementing ePatient 25 and what they plan to do with ePatient 13. So let's get into that. I'm going to go ahead and share. Let me share my screen. So where we are with the critical patches and the V3 timeline, we are now into October. So as Chris just demonstrated to you, we have the resources posted for CP6, Critical Patch 6 for version 3.5.0 and Critical Patch 2 for version 3.5.1. Those are on the website. And just as a reminder, what those new critical patches do compared to the earlier critical patch was released on April 7th was that the new critical patch resources changes the recurrence of e-patient 25 to a 1-to-1, meaning that the e-patient variable or the e-patient 25 variable needs to be present in the XSD and can be populated with a real value, a not value, or a pertinent negative. And so those resources are on the website. The idea is that the NEMSIS TAC on November 4th, you'll see here with the green arrow, will switch to the critical patch for 3.5.0 and critical patch 2 for 3.5.1. At that date, then yes, e-patient 25 will need to be present in a record with a real value, not value, or pertinent negative, or it will be rejected at the national level. Let's answer a couple of questions related to that. We talked last time about what is the timing for when vendors, or excuse me, for when states or local agencies, when they switch, and how will that all work? Josh was kind enough to put together a little bit of a diagram here. I'm going to walk through it, Josh. I see that you're on, and so if I misquote something, please jump on. This looks more complex than it is, so let me walk you through this just real quickly. So this gray area here to the left for local agencies before the craziness of 2025, when the critical patches CP5 and CP6 came out for 3.5.0. Before that time, everybody was on 3.5.0 critical patch 4. That's where we were in the 3.5.0 series. So all agencies were CP4. When the state deploys the first critical patch, and hopefully states have done that, and that's part of the survey, and so we'll look forward to you filling that out. When the state deploys CP5 for 3.5.0, local agencies would still be able to submit on that older version of 3.5.0, the one that was present before 2025, or the local agency could have moved to CP5 or even CP6 and still be able to submit data. Because based on those critical patches and the fact that the state had employed critical patch 5, e-patient 13 may or may not needed to be in the record, and e-patient 25 may or may not be present in the record. Under CP5, the state would still be able to receive that record. Now, when the state moves to CP6, that's the one we're talking about now, that at the national level, we will deploy on November 4th. Local agencies will not be able to submit if they're on CP4, the one that was present before 2025. Local agencies can still be on CP5, even though the states moved to CP6, if e-patient 25 is in the record. And is always in the record, is in the record, right? And that should be true because that's what CP5 added. But of course, we'd like to get local agencies to be moving over to CP6 on or near that date. But during the crossover, CP5 records, as long as e-patient 25 is there with a real value, not value, or pertinent negative, the file will still be accepted at the state level, and the file will still be accepted at the national level. What this means is that with CP6, as we know, e-patient 13 may or may not be present in the record. That remains the same. All we do is change the reoccurrence for e-patient 25, and that variable must be present. So I'll stop there for just a second and see if there are any questions. And Misha, if you'd prepare to post those two surveys, that would be great. Are there any questions regarding CP6 for 3.5.0, which is the one that we're all kind of moving to? I can't necessarily see oh yeah, I can see the open and close. So let's see. So Lauren, yeah, thank you. So Lauren posted again, thanks. Have the data, let's see, have the date, the accept, and they need to be switched to CP6. Could you just state your question, Lauren, if you can open your mic, sorry.
Yes, sorry about that. So for the vendors, we would need to have the state advise us of the date that they're accepting it so we can flip the switch and have that critical patch elements being sent before November 4th, which would be the day we would install the national schematron. Because if we don't have that, calls are going to fail.
Yeah, yes, that's correct.
Clay, Greg Farmer asked, when will the compliance testing endpoint update to CP6?
So that's a great question. I think Amanda is out. Is there anyone else on the team that's been working with Amanda that can answer that question? Josh, do you know?
Yeah, Clay, I can probably help with that one. The compliance testing application is currently on CP5, which means that you can submit records with or without ePatient.25. And so if you're going through testing for supporting ePatient.25, then you can complete that testing now. So when compliance testing moves to CP6, yeah, probably soon. I don't think we've set a date on that, but you can definitely complete your compliance testing for verifying that you support the new data element.
Thank you, Josh. All right, in the chat, Misha has posted 2 surveys that should just take about 3 minutes to complete. The top one, the NEMSIS version 3.5.0 critical patch 6 state EMS office survey. That's for states to complete. We've had 14 states complete this survey since it was sent out on Friday. Other states, which I'll show here, the states that have not completed that survey, if you are on the call today and you represent any of these states, if you'd be so kind as to complete that survey while we speak here, that would be wonderful. We want to be able to provide this data to vendors and have states have information from their vendors. We'll talk about the vendor a survey in just a minute. We'd like to be able to communicate this information back and forth between both parties as soon as possible. So if your state is listed on the screen here, if you'd be so kind as to go in and complete that survey, that would be great. Then, as mentioned, we were also hoping that the receive and process could complete a very short survey. We have not had any of the vendors complete the survey since it was sent out on Friday. So here are the vendors that we would love if you could take just 3 to 4 minutes right now and complete that survey. It basically just provides information regarding the dates of moving to CP5 and CP6. If you'd complete that, that would be great. We will aggregate all this data after the meeting and send out an announcement that the findings have been posted once we can aggregate the data. I did see that there was a hand raised. If you do have a question, feel free to go ahead and ask it. Okay, if there are no more questions, I'm going to go ahead and just allow for 2 or 3 minutes of silence for both the states and the vendors to complete the survey. Oh, and I do see there's a couple more questions here, so we'll get to those questions after folks have completed the survey. Eliza, do you want to ask your question while we're pausing?
am I unmuted? Okay.
Yep.
I don't have a link to the survey. I also think I did it a while ago, but that's maybe neither here nor there. So, all right.
If you open up the chat, you'll find a link there.
I could, okay. I see. Okay, sorry.
Oh, no, that's great, Eliza. Yeah.
Sanjeeva, you can talk now. You're unmuted. You can ask a question.
Okay. Can you hear me now?
Yes, Sanji, I can hear you.
Yeah. Is there any changes to schematron files for CP6?
The
So when we
answer
download only.
is
Oh, go ahead.
basically no, except that at the top of the file where it indicates what build we're on, it'll indicate CP6, but there's no actual content changes to the rules.
Okay, we don't have to update anything on schematron rules, but only update on XST files, right? For CP6 changes.
Yeah, literally the one change you're making is that ePatient 25 has a minimum occurrence of 1. But I would deploy the new XSTs and deploy the new schematrons, just to be current. But that is the one change you're making.
Is that in critical path changes XST file or ePatient underscore V3 XST file? I try to look at the changes minimum occurrences. I don't see it right now. That's what I'm asking. Is that allowed to change the states update the minimum occurrence to 1 to test in our local environment?
It is in ePatient underscore v3.xsd.
Okay. Thank you. I'll check that file. I appreciate your help. Thank you.
Yeah, thank you for the question, Josh. Walters?
Hey, yeah, the chat was disabled for me, and I was not able to unmute until just now. And it may be impacting other folks.
All right, Josh, did you have a question or no?
I think it's just letting us know that some people are not seeing the chat for the links.
Okay, great. Let's get to a couple of questions that we have in the Q&A. Amber from Colorado asks, can a state allow agencies to leave ePatient 25 blank and choose to map ePatient 13 for them upon sending to NEMSIS? The answer is yes.
So then how would we fill out this survey?
I'm not looking at the survey, but I think there is an option there that says, maybe you'd have to list that in other, Amber, as the
Right,
option.
because the question is about a date, right? On which date do you plan to deploy the critical patch, which would require ePatient 25 to be present on all PCRs, even if it is left blank. If we allow our agencies to leave it blank and then we map it on their behalf or superimpose a not value, I think it just makes it difficult for us to answer that question. It's like, well, they could continue to leave it blank when they send it to us.
Oh, yeah, they'll be able to always leave it blank if that's what you choose to do for your state. So just when, because of course, if it's blank, then a not value is populated into that field.
Right.
I guess the question is really, when are you going to require that the ePatient variable be present in the file sent by agencies, CP6, with a recurrence of ePatient 25 1-to-1.
They could always send a not value.
Yep. Yeah, great clarifying question, Amber. All right, Lauren, I also have a question or a concern about going live for 3.5.1. The hard cutoff of first of the year won't be feasible as vendors have 90 days for compliance and some haven't started that process. For example, we have a LEMSA in California requiring on 1/1/26. Also, if NEMSIS or regions have hard cutoffs, they need to attend these meetings and have a page on the NEMSIS website where those dates and resources can be found, especially if they are expecting vendors to send directly to them prior to this date. Yeah, so let's clarify that a little bit. Thank you. There isn't a hard date associated with the movement of 3.5.1, and I apologize if there was.
No, I think from the LEMSs, so we're not getting communication from LEMSs or regions, but we're getting customers saying that they're going to lose licensures if we're not sending that on that date. And so my question is, can we talk about that here about hard cutoffs for 351 versus accepting it? And then the second thing is, how do we handle these regions and LEMSs, because vendors aren't getting the data sets and schematrons that are needed, the communications. And I think that if we're supposed to be or required to be doing some of these things, then they need to be a part of these conversations and act as if they're a state, if they're accepting.
Yeah, great question, Lauren. Yeah, great question. Thank you for bringing it up. We've been in communication with the state of California as well, the NEMSIS TAC regarding this issue, and I think we're kind of in negotiations with them. I think there was a misunderstanding in regards to the idea that there was a hard date in regards that the NEMSIS TAC was promoting. And so again, I think that there was a miscommunication that happened there. At the level of the state in California, we're in active discussions with them just to make sure that they understand that process. So I'm hopeful that will be reconciled. Yeah, so thank you for bringing that up, Lauren. I'm sure that was a concern for lots of folks. So thank you for that. And then in regards to talking about hard dates for 3.5.1, that's my second topic that I hope to get to after this one, but we can talk a little bit about some of the resources we're trying to prepare to kind of negotiate and kind of facilitate version 3.5.1. I don't even think it's really on anybody's radar now or should be on anybody's radars. We're just trying to ensure that the critical patch happens correctly and efficiently across the country. So we're excited. We're preparing some resources, and I'll talk about those in a moment, that we'll be able to review together as an industry probably late in November, and we'll be talking about the rollout of version 3.5.1 at that time. Yeah, thank you, Lauren. All right, Steve from CSI, if version 3.5.1 compliant already, is there any action still required for the 3.5.1 CP6? So Steve, I'm not sure I understand the question. If you have a group that is compliant with version 3.5.1, that's great. They'll want to be on CP2 as of November 4th. Does that answer your question, Steve? Okay, great. Josh Walters, did you want to ask a question? And then I'll get to the rest of the questions here with Lauren from Lauren and Craig.
I apologize. It's not really a question, but I still cannot view or participate in the chat, and it may be a local thing. I don't think so, but there may be others that are facing this.
Josh, are you able to see the Q&A button in the three dots that say more? The chat has been disabled, but the Q&A feature should be turned on.
I can now. Thank you. Sorry, that's a me problem.
Oh, Josh, it's a little confusing as we try to protect the security of the meeting. So thank you for checking. Lauren, to Amber's question, how do vendors handle that? Because with the one-to-one, we'll send it in XML. So Lauren.
Oh, this was already answered. Sorry.
Okay.
Thank you.
Oh, okay, no problem. Craig Farmer from Ohio. I built the new CP6 schematron, and it does not throw an error when validating the ePCR that does not include ePatient 25 in the submission. Is this expected? I would say no. Josh, yeah.
Yeah, I can take this one. So if ePatient.25 is completely missing in the PCR, then it will fail CP6 XSD validation. And as such, then you stop there. You don't even run schematron validation because it failed XSD. Schematron validation has a rule that says if there was a patient who was treated and ePatient.25, it triggers on ePatient.25 and looks to see that ePatient.25 has a real value in it. So you need to record the sex of the patient if they were treated. But that rule only triggers on the presence of ePatient25. So that's important to get that sequence right. You're going to fail XSD validation first and not even get to schematron validation if you're missing ePatient.25.
Thank you, Josh. Thank you for the question, Craig. Any other questions in regards to this topic? CP6 for 3.5.0 and the process of moving, what's required of agencies? Any questions? Would it be helpful that kind of illustration that Josh prepared? Would that be valuable for us to add some narrative? Josh has some narrative associated with it. Should we send that out to you as states just to kind of help you as you're socializing what's happening with these critical patches? Would it be valuable to have that to help understand the relationship between states and agencies during the critical patches? Any thoughts? Thank you, Rita. Okay, great. We will work on preparing something that we can send out. I think that will be helpful. Okay, great. And I think I have the very next topic, and it's related to versioning of NEMSIS and when and what we're doing with version 3.5.1. Much of, I think, the confusion or the lack of clarity has been related to this visualization that you can see. So we're working on updating this visualization. We unfortunately kind of built this visualization to handle two things at once. And so the critical patch has thrown a wrench in this for all of us. And so we're going to take this document, which, as you can see, as it's labeled, this is supposed to be the EMS data standard versioning just plan for the next 10 years. But what we also did, the purpose of this was just to describe the plan, how major releases will relate to minor releases, how long a major release will be open compared to a minor release, what is a minor release versus an informational release versus a critical patch. All that information that's here, that was just to help people visualize how versioning happens in NEMSIS. What we decided as an industry to use as a template going forward. But then we also, as you can see, put into this the actual versioning of 3.4, 3.5, 3.5.1, and even 3.6. So we're going to separate these two. One will just be this diagram that just describes how versioning happens. What is a minor versus major? What is consensus? What is the software build? All those things that are defined here. And then we'll come up with a separate plan moving forward from here with the critical patches completed by the end of this year. What we'll be doing for 3.5.1, do we want another minor release, major release? All those decisions, we will begin to make those decisions together on this call in November, in late November. So I'm sorry that this has caused confusion, particularly with the critical patches that were kind of out of our control. We will work to provide two documents that will be much clearer in regards to this document, versioning versus what we plan to do moving forward. And I apologize, I just held my hand up and it raised my my hand for me. That was inappropriate. So are there any questions about versioning moving forward?
I think Karen Jacobson wanted to ask a question. May have been in the past segment, but
Oh, yeah, Karen. Yeah, please. Oh, yeah, please. Please, Karen, please go ahead and ask. We can step back.
Thanks. You know how it is. It was, I didn't get it typed in quickly enough.
That's okay. That's okay.
So my question is related to a lot of the conversation was had. So Josh just mentioned as it relates to ePatient.25 for V3.5.1 CP2. He talked about the schematron rule. And so the schematron rule is NEMSIS_E193, and it reads, sex should be recorded when patient evaluation care is patient evaluated and care provided. So there's been some discussion around the previous agenda item that said that element could be submitted with a not value, or maybe even a pertinent negative, but a not value if it's left blank. But that rule is not going to take into consideration if ePatient 13 is what's submitted in the file. So my question is, does that rule need to be updated to allow for a not value when ePatient 13 has a real value, or are we just expecting that software is going to submit a real value of female, male, unknown, or a pertinent negative? So I'm just confused about the rule and the discussion that we had for the previous 10 minutes.
Yeah,
Is anybody confused?
Yeah, I can maybe jump in on that too. So when an agency, when an ePCR system exports data and validates it, and it's on the latest critical patch, so CP2, CP6, then if there's not a real value in ePatient.25 and a patient was treated, then that's going to generate a warning. The record will still be valid, but it will have a warning. So if mapping is going on, like in Amber's scenario, where the local agency is submitting gender but not sex, and then the state is going to do some mapping and they're going to send it to national, and they're going to send sex to national, then the local agency, when they're generating that, they're going to have a schematron warning, a national schematron warning. And then when the state submits it to national, they're not going to have a warning because they're going to have a real value in there for ePatient.25 sex. So that is what it would look like.
Hey, Karen, does that answer the question? Okay. Feel free to jump back in, Karen, if you have any other questions.
Yeah, sorry, I had muted myself because I was typing notes and I didn't want my clacking to interrupt Josh. So that answers it. I think there's just, people are going to be confused when they see that schematron rule, and maybe an option for states then is to not have the national rule for ePatient 25 active in the state's system, but it could still be an issue. We'll see, right? We'll just see over time. All right, thanks, guys. I appreciate it.
Yeah, I agree. If you're doing some kind of mapping, then you're probably going to have to do some work around how you're showing validation rules.
Exactly. And of course, that's going to trickle down to agencies as well with their own software system.
Yeah,
it could be complicated for, the first few months. Thanks again.
All right, and Ben, I just listed some information in regards to how to ask questions, to release a question. Any other questions? If you haven't been able to type it in, feel free to just unmute, and we're happy to take your questions regarding versioning or the critical patch rollout. Okay, great discussion and great questions. Thank you, everyone. Hopefully you had time as states and vendors to complete the survey while we cover this section of the agenda. We'll do our best to get those results out quickly and organized in a way that will be helpful for you as states and vendors in regards to kind of making sure that plans are clear between the two of you, a vendor and a state, as we move to CP6 and CP2. All right, John, I'll hand it back over to you.
All right, thank you, Clay. So I think next up, after that lively discussion, will be Miss Bengie Alexandre with a maintenance update. Okay, I think Bengie's having.
Okay. Yep, I'm here. Wasn't there? It is. All right. Thanks, John. Good morning, everyone. For the maintenance updates for the month of October, the maintenance window will be moved forward 1 week to October 15th and the 16th. So there's no need to report any issues during the maintenance window. But if you do experience problems outside that time frame, please submit a help desk ticket. And moving forward, when you need to check the maintenance window, you can go to our website, go to technical resources, NEMSIS maintenance schedule, and it will have the schedule for Q4 down here. So I'll just go ahead and move on to the next topic item. So for the monthly report for the month of September has been emailed out, and it's available on our website as well under View Reports, Public Reports. Click NEMSIS Monthly Report, and you will see the monthly report for the month of September. One highlight for the month of for the monthly report this month is our 2024 National EMS Data Report. Has been posted on our website, and you can also find it on the website as well. And yes, and so. Oh, I wasn't screen sharing. My apologies.
We see your screen now.
Are you seeing the website?
We are, yes.
Okay. I'll backtrack really quickly. I'm sorry, I wasn't aware that we weren't seeing the website. So for the month maintenance update, if you go to our website under technical resources, the NEMSIS maintenance schedule is here for Q4. And if you go under View Reports, Public Reports, NEMSIS Monthly Report, you will see the September monthly report posted here. And the last thing that I wanted to share today is the annual meeting notes. Thank you to everyone who participated and shared feedback and comments. And thank you for your participation in conversations. They will impact the direction we will take in many areas this year. So we will continue to review your suggestions and decisions made during the annual meeting. We are currently meeting as a team to determine the next steps and to follow through on action items. And once we finalize them, we will share them with you all on the call and or via email to see if we can provide any additional comments or to see how we can improve our meetings moving forward. If there aren't any questions for me, John, I think I will turn it over to you.
Great. So we'll go back to Mr. Randall Eimerman for the NASEMSO update.
Yeah, John, you broke up a little bit there. Could you show the agenda again? And I apologize, you broke up a little. Oh, there's Randall. Yeah. Thanks, Randall.
Sure, John. Did you want me to go ahead and go?
Yes, go ahead.
Perfect. Thank you. So, quick update here for everyone. Data Managers Council, they have two new custom data elements that we're going to be bringing to our business meeting for final approval. There is a third one around like the reason that the medication was discontinued, but I don't have that one completely worked out. But for today, the first one is the date and time the medication has been stopped. That's a new value to be added there. And then also the FIN number, which is the blood facility ID number. That kind of correlates very closely with the donor identification number. So now we'll have both numbers to be represented there. Let me see here. Next update here is about the extended data definitions. The DMC, they've been doing a lot of work in the background where instead of kind of participating in the extended data definitions independent meeting, we've been doing a lot of this work through surveys and through emails and the forum on NASEMSO. This process has actually gone really well because we've been able to sort of give an example of an answer, trying to keep it as close with the language of the previous extended data definitions and fill them in. The biggest update we have for that right now, and then we'll be bringing those also to our business meeting, is there's some new data, some new field values for some of the existing data elements within the extended data definition. Those are e-response 09 with the addition of out of service area response, e-history 17 with the bystander or family reported drug use, and then also bystander or family reported alcohol use. The additional, I apologize, everyone. My daughter is home with me, so she'll probably come hang out. 1 second, okay? So we're also working here on e-airway 14, e-medications 13, e-procedures 15, and e-scene 25 for extended data definitions. The last update I had for everybody is about a guidance document that the data managers are also working on. We've had a couple special meetings about this one to see if we can kind of highlight it and get it moving forward. But it's the artificial intelligence use in EMS. And the guidance document outlines the benefits, risks, critical considerations for our EMS leaders that they must evaluate to ensure responsible, secure, and ethical use of AI technologies within their operations. Some of the big categories there are the benefits of AI in EMS, the risk and confidentiality concerns, and also considerations for our EMS leaders. So once that one is completed, we'll have a bigger announcement about it, and those will all be posted to our website. Last announcement, really, just about our our regional meetings that are taking place now. The NASEMSO Great Lakes meeting has already happened. They've got a lot of great information from our annual meeting. Currently, I believe in session now is the Western Plains meeting, and then later in the month of November will be the East Region meeting, and all of those regions will be getting updates on NEMSIS activities. I can take any questions, comments?
Thanks, Randall. Next up, we have an update from the NHTSA Office of EMS from Mr. Jeremy Kinsman.
Hey, good morning, everyone. Can everybody hear me okay?
Sound great.
Yes. Yep.
Okay, wonderful. Hey, thanks for joining this morning. Just a couple of NHTSA updates from our office, and then I'll just transition right into a pre-hospital blood update. I'm sure folks are aware that parts of the federal government are shut down. NHTSA, we are funded out of the Highway Trust Fund, so we are open for business. We're here, we're working. So if you need anything from us, please do not hesitate to reach out. Similarly, our funding that supports the NEMSIS contract and all the great work that Clay and the team at the NEMSIS TAC are doing is also not impacted by the shutdown. So they are obviously we're all on the call here together, so they are working and they're available to help with whatever you guys need as always. So that was the first thing. The second thing, our National EMS Advisory Council is accepting applications. I think the deadline is October 20th of this month. So even though there is a shutdown and that impacts the Federal Register is where you go to submit the application, you can still submit your application. So if you or folks that you work with are interested in serving on NEMSAC, please submit an application. I think there's 25 different sectors that are represented on NEMSAC. I know at least one of them is related to EMS data. So if you're interested, please submit an application. I know we sent an email out, I think 2 weeks ago with a link to that, but we'll make sure that we get some link out to you all again after this meeting. A couple other things. I mentioned, I think maybe on the last call that we had, that we did have our new administrator was confirmed by the Senate and was sworn in a couple weeks ago now, Jonathan Morrison. So we have a leadership team at NHTSA that's fully in place now. They continually express to us just their understanding of the importance of post-crash care and specifically pre-hospital blood. So right now, staff in our office is in the process of reviewing a lot of SS4A grants that are specific to post-crash care and pre-hospital blood. And the current administration is really excited about those opportunities. So there should be one more SS4A grant opportunity coming out in the early spring. So for those of you who have interest in that space, I know there's a lot of local, that money is set aside for locals, so municipalities, and groups of municipalities and cities, counties. So you can go on the SS4A website and see who has applied, kind of where you operate to date, and you might find out that you have not applied or no one in your area has applied before. So now is a good time to start kind of thinking about if you could maybe tag on to an application that's in process or work that's kind of already being funded via SS4A. And if not, you could submit a new application early next spring. So I want to point that out. We have had a number of folks apply for post-crash care funding through state highway safety grants. We encourage you to continue to do that, to connect with the state highway safety office to see what opportunities there are for you to submit a grant to support post-crash care. So please continue to do those. If you need help with any of those things, if you're looking for additional information or support from us, myself and our office at NHTSA will be happy to help you. I know Clay and the team at the NEMSIS TAC will be happy to help you. And also, I know there's been a few vendors that have been really helpful in helping provide some data and support for their local EMS agencies with applications specifically to SS4A. So lots of great opportunities out there for folks, and let us know what we can do to help you. Let me just stop there before I kind of transition into a blood update to see if folks have any questions specific for the NHTSA Office of EMS. No? Okay. All right. I'll keep going here. So I know I've mentioned several times that we at NHTSA have an interagency agreement with the Uniformed Services University and specifically the National Center for Disaster Medicine and Public Health. The National Center for Disaster Medicine and Public Health is being combined with a couple other military health entities. And so I think they're going to update their name. So there's going to be a name change, but for today's call, I'm just going to refer to them as the center. So we're going to be working with the center. We'll have an announcement soon about a couple other entities that they're contracting with that is going to help us with this pre-hospital blood transfusion demonstration programs that we're going to be implementing across the country. We're looking at implementing 25 sites. That's going to help us to evaluate the impact of pre-hospital blood on motor vehicle crash patients. So we're going to be working with an entity who's going to be helping those demonstration sites export their EMS, police crash report, and hopefully their hospital outcomes data as well. So as we've got more information about that, and we can share more information about who those entities are and who these demonstration sites and their local EMS agencies may be working with, via the National Center, we'll share that information as soon as it's available. Hopefully, maybe by the next call. So that's a great opportunity. One of the things that Clay, the team at the TAC, and Randall, and Amber, and members of the DMC have been working really hard on is trying to help us move towards a more standardized approach to doing documentation of pre-hospital blood administrations. We've been working with the coalition on that as well. I think folks are all aware about that. We did have a panel at the annual meeting. So one of the things that we're planning to do moving forward on this call is to regularly have this blood update and present some information to you all on things that we're encountering in terms of helping us to move towards that more standard data documentation. I think one of the things we've realized is that, and we've talked about this before, but paramedics that are providing these transfusions in the field, in a lot of places, they're not using the NEMSIS data standard elements to do that documentation. They're not using e-procedures or e-medications. They may be documenting the information on a paper field. They may be using custom elements. They may be using a supplemental question or some type of other process that they have available to them through their software vendor where they can create kind of questions or elements on their own. And so I'm hoping that we can use part of the V3 call to present updates and what we're kind of learning in that space, and how we can maybe improve and just kind of all get on the same page. My hope would be that, states, vendors, others, if you hear about EMS agencies and that you're aware of that are going to be starting with one of these programs, I would really hope that you would make sure they're aware of the NASEMSO data documentation guidelines on pre-hospital blood, and really try and encourage those folks to make sure they're using e-procedures and e-medications to do that documentation. I think for the programs that already exist, that's where we're going to be kind of reviewing cases where we're not able to identify that data at the national level. And we'll be reaching out to states to see, do they have the data in their state repository? And if they don't, then working kind of with like the local EMS agency and the vendors to see if we can't come up with a solution. So you can expect that, I think, our office, the NEMSIS TAC, the DMC, and the vendors, as well as they're open to it, we'll be reaching out to folks and trying to work together to improve that. I think primarily because, as there's these funding opportunities that are available, we need to be able to, at the national level, go to NHTSA leadership, go to other leaders at the federal government and show the value of pre-hospital blood and really other post-crash care interventions as well. And so we've got to make sure that we have accurate data that we're collecting at the national level to capture these cases and show their impact. So, so we'll have this regular blood update moving forward, and we really hope that folks are open to working with us. And let me stop there and just again see if anyone has any questions about what's going on at NHTSA in our office, or if anyone has any questions about blood documentation. All right. If not, thanks very much. As always, if there's anything we can do for you, please don't hesitate to reach out to us. Thanks.
Thank you, Jeremy. So, thank you all for your participation today.
John, it looks like we have a hand up from Amber.
Oh, I didn't see it. Oh, okay. Amber?
We can't talk about blood without me chiming in, especially in the month of October. But just want to kind of reiterate all the things that Jeremy said in trying to get the vendor products on board to ensure that we've got, data at the national and state level. The DMC is working on a updated blood guidance document, and I think the last time that we laid the foundation for the documentation guidance, we had a lot of good input from vendors, and I think we want to follow that same trend. So as we're kind of compiling some things together, I guess the question here is maybe for Clay and the NEMSIS folks, is this conversation where we can get the states and the vendors together something we want to accomplish through one of these NEMSIS calls, or is that something that we want to have kind of a special DMC meeting call? Just looking for some input there.
Yeah, Amber, that's a great question. And to kind of add a little bit more detail in regards to what Jeremy shared, we work with the coalition as they update. They have a process where they're identifying agencies that are starting pre-hospital blood programs, and then they're kind enough to send us a list of those organizations. We then look at what counties those agencies are serving, and then check within those counties to see if we're receiving blood. This is just kind of a first pass to see, to make sure that we're getting the data. So Amber, it's a great question, right? Once we've just received an updated list, we received that just a couple of days ago. We're working to kind of look at the additional agencies and whether or not we're receiving blood transfusions from those agencies. And so I love the idea of us potentially getting together as states and as vendors to see if we can just identify any issues that we're experiencing in regards to the collection of those at the state and national level. I think that's a great idea, Amber. We can organize a separate meeting, or maybe several, right? Just as we begin to work through that process. So thanks, Amber. I'll make a note of that.
Jonathan has his hands up.
Hello, friends.
Hello.
Can you guys hear me?
Yes.
So I want to tack on to Amber's statement, but also expand, if I will. Can I ask for? I don't know how many people are here actively with us, but show of hands, I guess, if you heard about the law change in California last Friday relevant to EMS data. Anybody? No? Okay. So I'm assuming that most, if not all, of my fellow companies here do work in California. And there's a couple states here who are going to look at what California does and say, hey, you got a lot of people. So as of last Friday, Senate Bill 660, and again, Senate Bill 660 mandates that all fire and EMS agencies, all EMS services as defined by California law, which is all of them, basically, are required to participate in the California State Data Exchange Framework. There will be a lot of more material from me, and I'm sure, and I know from others, there's already material bouncing around social media, et cetera. EMS is listed specifically as a mandatory participant in that conversation, which has implications, Amber, for what you just said. It has implications for what Jeremy has said. John, for what you were saying, basically the idea that data need to be captured, data need to be shared, data need to be accessible. And the cool thing, this is where it gets really exciting, is that the underlying framework, the data exchange framework, establishes legal parity, not parity as in joking, but parity as in you're on the same level. And it's important because this is a recorded call, right? So it establishes legal parity between ambulance and fire services and the rest of the healthcare ecosystem. You can get your outcomes, you can get your insurance information, you can get your clinical data shared with the hospital, you can get that blood information shared into the hospital's electronic health record system. You have to do it in a specific way, and those are defined in the law. This law is an update to Assembly Bill 133 that went into that was signed in 2021 and then rolled out statewide in 2024. So again, this EMS was voluntary up until now. EMS and fire are now mandatory participants in that. And there are already 14 fire and EMS agencies that are on the network. They represent users of our MetaView system, as well as ImageTrend, ESO, First Do, and Zoll. But it is not limited to those. And this is to be clear, all of your goals, Amber, when you talk about the sharing of data, the how you do it, the what are you capturing, making sure it aligns with the hospital side. I hope Josh Legler is, wherever he is, jumping for joy. This is a lot of what he's been pushing for years, and has come to fruition as of last Friday. So October 3rd, it was signed by the governor. So I want to make sure that there's no lack of clarity. It's actually a pretty short reference to EMS. We are listed under a bucket of required participants. There are 7 of them. We are number 7. So it's not a very long law, or the law itself is, what it is, but it is very clear. It says emergency medical services as defined, and it lists the title. So I'm happy to answer any questions folks may have here or later. But there will be a lot of words shared about this from a lot of stakeholders. There are state level organizations. There is a governance body that is being set up. There are some implications for not participating in it. We and others will be publishing that. Folks are publishing it for the whole group. We are, of course, focusing on the mobile medical community. But I wanted to make sure that you knew that this had just happened. And so to the extent, Jeremy, that you are talking about getting outcomes and whatnot, this is your moment, man. So there's a lot to be said here, but again, it is a cross-industry participation. There are other vendors that are working. This is not about anyone advertising themselves. There are small agencies, large agencies, rural areas, urban areas, private services, public services. All have already had one or more participants in this, and hopefully the rest will follow suit because the law requires it. So congratulations to Amber and Jeremy, since you guys saw the future.
Thank you, Jonathan.
And if you go, by the way, if the TAC is not familiar with this already, I'm happy to share. Well, like I said, I'll be sharing plenty of information, but I'm happy to send you more about the code. Again, it is Senate Bill 660 in California, and I would encourage you to take a look at it. We are in, I believe, section something F number 7. But if you look up the law and you Google emergency, you will find it. There's only 2 references to it in the document.
Thank you, Jonathan.
Got it.
Are there any other questions or answers that need questions? Well, if not, I'll remind you of our next meeting, which is October the 22nd, on the 4th Wednesday. And our next public training is November the 4th. With that said, we'll transition to the break rooms. Just a quick reminder of how they work. So these are hosted by the vendors. There's a rotating schedule, and this is a blue week. Vendors are required to have a participant in their break room on their assigned week, and attendance and participation for vendors will be documented for compliance purposes. State and agency representatives are invited to join any room where you are interested in joining the conversations. Vendors should only join their own rooms. A TAC member will be present to help facilitate the discussion or answer questions. You should see a prompt on your screen to join the breakout room you've been assigned to. Just click join to enter your room. And if you have any questions, we'll have someone at the TAC here in the main room. So just please post it and let us know how we can help you. Otherwise, have a great day, everyone, and we'll see you on October the 22nd.